of the year of 2023. So I'm Dr. Kathleen Kieran, along with Dr. Peter Asante. I am the co-chair of the WCAAP Equitable Care Committee, and we're really, really excited to bring you the most recent webinar. So without further ado, we're going to jump in. We want to go to the next slide. This is a picture of our Equitable Care Committee. This was taken over the summer when we were out at Children's Village in Yakima for our retreat. And you can see many of the familiar faces we were just talking to on this call. You can see them there. These are the people that really do the work. For those of you who are not familiar with the context of the Equitable Care Committee, this was something that had been kind of considered for a while, but in 2020, we obviously had a national reckoning on race, and that kind of pushed us forward to think about how we could improve care for the children of Washington State and to make it more equitable and to help those who care for children, whether they be parents, caregivers, providers, to provide better, more equitable, more effective care for the children of our state. I want to go to the next slide. Part of our work is these webinars. Part of our work is the toolkit. And again, the toolkit was put together by all the people that you saw in the prior picture. And the toolkit has multiple sections. We are in the process of updating it. It will be done by the end of the year. But the toolkit provides a written resource, an electronic resource, and a hard copy resource that providers and those who care for children can use to provide equitable care to children within our communities, whatever that community might be. And Kalani just put the toolkit in the chat for those of you who may be interested. So look forward to the next iteration of that because it will be coming out in the next 30 days or so. And here are our toolkit contributors. You can see that they're again, some more people here, but I really just want to highlight the people that do the work. And Peter and I are very lucky to have this team because they have come up with many amazing things that we would have probably not thought of on our own. So thanks for pushing this forward. And I'll turn it over to Dr. Asante to have us meet our presenters today.
Hi, good morning. I'm Dr. Asante, and happy December, everyone. I'm so glad for all the coffee, cats, dogs, and kids that are also joining us today. I'm here to introduce our speakers. The first is Dr. Mary Beth Bennett. Mary Beth is a third-year resident pediatrician with a background in communications and entrepreneurship who prioritizes children's health in clinic and through advocacy. She's an active member of the Washington Physicians for Social Responsibility's Climate and Health Task Force. Mary Beth recently co-authored a new chapter on climate change and the impact on children's health for the Yale Primary Care Pediatrics curriculum. She has 3 kids of her own with whom she enjoys exploring the Pacific Northwest and its many natural wonders. Our second presenter is Simona Martin, Dr. Simona Martin. She's a second-year pediatric resident at Seattle Children's Alaska Track and splits her time between Seattle, Anchorage, and Bethel, Alaska. She grew up in New Mexico and credits the Southwest for her passion for climate advocacy and love for the outdoors. She obtained her undergraduate degree from the University of Chicago and medical degree from the University of Michigan. Her interests include rural medicine, native health, environmental justice, and education. And then the third presenter is Dr. Angela Zhang. Angela is a pediatrics resident at the University of Washington Seattle Children's Hospital residency in the health equity track. In the residency, she is involved with the resident-led diversity committee, as well as co-directing health equity rounds. During medical school, she was selected as a fellow for the Office of Diversity and Multicultural Affairs, working in anti-racist med-ed, dismantling biological race-based medicine, and retention support of underrepresented minorities in medicine. She's interested in audio journalism and produces a podcast about structural and spatial inequity in medicine called Not Built for Us. She strongly believes that dismantling oppression involves collaboration from all fields within and outside medicine, and most importantly, the communities around us. She's additionally interested in API advocacy, allyship, and climate and spatial justice. She enjoys bike commuting, pottery, dance, yoga, and sometimes being a plant and reactive dog parent. And so with that, I'm going to let our presenters take it away with our presentation. Thank you guys so much for joining us this morning.
Great. Thank you so much, Dr. Asante and Dr. Kieran, for inviting us to give this talk today. And thanks so much to Alexis Jackson for all of your hard work in helping us put it together as well. Yeah, we can get started. So we can do the next slide. Great. So we are members of a resident-led group out of Seattle Children's called Peds for Climate Action. We would be remiss if we didn't acknowledge Dr. Allie Perkins for all the work she did to create this group and really organize a community that cares about the cause. So now we're merging with the Seattle Children's Pediatrics Climate Care Committee led by Dr. Molly Groh. We have no conflicts to disclose. And just wanted to say that we do not claim to be experts or speak on behalf of the communities that we'll be discussing today. And we just wanted to share our research on the topic as it impacts pediatricians and pediatric care providers, as well as the patients in the communities that we serve, and really hope to start as kind of a launching off point for further discussions in this realm. At the end of the presentation, we'll provide some references where folks can learn more, as well as highlight some of the community organizations who are the experts on the subject matter and who are doing the frontline work in environmental justice today. Yeah, next slide. So here's just an outline of what we're hoping to discuss today. So we'll start off with some introductions and some definitions. And then we'd like to delve into some specific environmental health disparities in Washington. And then we'll close out with some opportunities for action for folks. Next slide. So at this point, I think many of us on this call have either heard really great talks or read great articles published about the intersection of climate change and health. I feel like in the last few years, it's become something that's been talked about a lot more, which I think is excellent. There have been multiple pieces written in well-established medical journals like the New England Journal of Medicine or the Lancet. The Lancet in particular has called out climate change as the greatest global health threat facing the world in the 21st century. But as a refresher, we took this figure from a paper that was just recently published in the New England Journal of Medicine by Dr. Pereira and Dr. Nadeau. And this highlights the health effects of climate change and pollution on kids in particular. So they lay out multiple different exposure pathways that affect children's health, from heat stress to air quality, all the way to displacement caused by weather disasters. And then they also lay out the various susceptibility factors that make kids more vulnerable to these exposure pathways than adults. So everything from, kids being younger, and so just having a longer lifetime to be exposed to these things, to biological factors like developing organs and greater fluid or nutritional environments. And then also touching on some social factors as well that might make kids more vulnerable to these exposures. And then they spell out kind of the health effects that you can see from these things. And there's really, very few organ systems or parts of kids' health that is not going to be affected or is not affected by climate change and pollution. An important lens to consider when looking at a figure like this is that not all kids are equally susceptible or affected by these processes. So we'd like to build upon this understanding and kind of talk a little bit more today about environmental justice and environmental racism. We can do the next slide. So environmental racism as a term was first coined by civil rights leader and former chair of the NAACP, Dr. Benjamin Chavez Jr. back in the 1980s. And he defined it as environmental policy, or he defined it as racial discrimination in environmental policy making, enforcement of regulations and laws, and targeting of communities of color for, in particular, toxic waste disposal and siting of polluting industries. The first book that was published on the matter was a book written by Benjamin Bullard called Dumping in Dixie, that kind of expounded upon the historic siting of toxic waste facilities and landfills in areas with folks with increased numbers of either the elderly, young, and minoritized, mainly Black residents. And in this book, Benjamin Bullard kind of broadened the definition to include any sort of policy, practice, or directive that differentially affects or disadvantages, whether intended or unintended, individuals, groups, or communities based on race. We can do the next slide. So setting our sights onto Washington, this is a tool that was recently put out by the University of Washington Department of Environmental and Occupational Health Sciences. And what they did is they took 19 indicators of community health, where they looked at measures of pollution, proximity to environmental hazards, population health, and socioeconomic status. And they used that to create a score used to rank each of Washington's census tracts on their relative environmental health risk. So the ranking reflects a variety of factors, from higher rates of poverty and unaffordable housing to more folks with greater susceptibility to health effects of pollution. For instance, more people with cardiovascular disease. The tool also reflects the proximity of roadways, Superfund sites, wastewater discharge, and facilities using toxic substances. Areas with higher environmental health risks are colored red. So I'd like us to just take a moment to look at where each of our communities lie and think about how they compare to other areas of Washington. And then just wanted to take one more moment to think about ways that we've seen environmental racism play out in our own communities. We can do the next slide. So environmental justice, on the other hand, we took this definition from the EPA, which put it out this year, actually. And I'm sorry, it's kind of a long quote, but so environmental justice they define is the fair treatment and meaningful involvement of all folks, regardless of race, color, national origin, or income, with respect to the development and enforcement of environmental laws, regulations, and policies. And in particular, they highlight that there's two parts to this. So the first part is that folks should be granted the same protection from environmental health hazards, as well as importantly, have equal access to the decision-making process to have a healthy environment. This is just important because it emphasizes, both equality and protection, as well as representation in policy making and making sure that folks have equal voices heard and equal seats at the table. Next slide. So now that we've gone through some definitions, we wanted to explore a couple of the environmental health disparities seen in our own state. And I want to say that this is by no means a comprehensive list, but rather meant to highlight the multiple types of disparities that our patients might face. Next slide. So first, we'd like to talk about heat exposure. Next slide. So before talking about heat, we wanted to just quickly define the concept of redlining, which I'm sure many people, or maybe everyone on this call has heard, but so basically back in the 1940s, a federal policy called redlining was introduced, where the Homeowners Loan Corporation Act created criteria for determining creditworthiness for neighborhoods in American urban centers. And this was dependent on the racial makeup of a neighborhood, And basically, neighborhoods were graded from A to D, and neighborhoods that were predominantly white were graded A and colored blue to indicate that they were the best areas for investment, while neighborhoods that were predominantly Black were graded D and colored red to indicate to mortgage lenders that these neighborhoods were hazardous or basically too risky to insure mortgages. And so with limited financial assistance, it was pretty much impossible for Black families to buy homes or to move into other communities. And these racist policies have had intergenerational effects that persist today. Next slide. And so really in Seattle, so this is a map of Seattle, and redlining and segregation caused disinvestment in BIPOC communities in Seattle and across the country. So just wanted to take a moment to look at these maps and see if you can notice any patterns between the historical redlining maps and today's racial distribution, canopy cover, and temperature in Seattle. So temperature being red being hotter and blue being cooler. So yeah, although these racist policies have been removed from legislation, the legacy remains today. Next slide. So a study done by a group out of Virginia looked at historical redlining maps in 108 US cities across the country. And they also looked at satellite-derived land temperatures. And what they found was that in addition to lower canopy cover, redline neighborhoods had increased roadways and industrial buildings that retained heat compared to non-redline neighborhoods. And you can see there with the decreasing canopy cover as you go from kind of the most desirable to the least desirable labeled neighborhoods, and industrial covers or industrial services really creep up, as does temperature. So this was the first study, that's been done to show the impact of redlining on creating urban heat exposure disparities today, which is pretty striking. Next slide. So in Eastern Washington, we have another example of increased vulnerability to heat-related illness. So farm workers are 35 times more likely to die from heat-related stress than workers in other industries. And workers often have to make a difficult choice to either protect their health or risk their income for the day and possibly their livelihood. Additional factors, including access to medical care, income, and work authorization status, make farm workers more vulnerable to climate disasters. Next slide. So the next disparity that we wanted to discuss is pollutant exposure. Next slide, please. Superfund sites are areas that basically have such severe contamination that they become eligible for a special federal cleanup program. And this is on the Spokane Reservation. This is called the Midnight Mine. And it's a mine that closed in the 1980s, but what was left behind was open pits, as well as lead, radium, radon, and uranium leaching into the groundwater, soil, and air. Uranium mining across the country has left a lasting legacy on other native lands across the country, as well as well water. So well water across Navajo Nation continues to be unsafe to drink due to high levels of arsenic and uranium in groundwater. So across the country, you see that many of these mines were sited in locations with large native and other BIPOC populations, and still have lingering effects today. So that's a sign that's on one of the nearby creeks. Next slide. So some populations are more vulnerable to the effects of the climate crisis because of where they're physically located. Native communities in particular have been historically pushed to small parcels of marginal land that are increasingly vulnerable to climate change. Next slide, please. In Taholah, Quileute homes are seeing increased flooding and destruction with worsening storms and coastal erosion. Next slide. And in Washington, we often take care of kids that come down from Alaska. When I practice in Bethel, I see kids from Newtok, which is a Yupik village that's been abandoned due to it eroding into the ocean as the permafrost is melted. The village has relocated to higher ground to a new site called Reykjavik, which is above the old site. And compounding the increased vulnerability of Native populations to climate change, the federal government has not been providing adequate aid. So the New York Times did an analysis of FEMA data and showed that FEMA is less likely to grant requests for aid to Native communities. So Newtok is an example of a village that was able to obtain funding to relocate, but other communities across the Yukon-Kuskokwim Delta, such as Jafornak, are facing similar problems and have not yet obtained the funding to do so. So this is just meant to highlight that climate refugees are not an abstract concept of the future. They exist now in the US and the patients that we serve in Washington. Next slide. And now I will pass it over to Dr. Bennett to talk about opportunities for action.
Thanks, Simona. So now that we've covered a few of the important ways that climate change and environmental racism are negatively impacting kids' health and the health of their families, let's move on and talk about some things that each of us can do individually and collectively to take action. Next slide. We like to think about opportunities for action on multiple levels, starting at the personal or individual level, what we can all do in our households and spheres of influence, then how we can act collectively as organizations and communities, and finally, on the state and national level through advocacy. Next slide. But before we move on to those actions, we'd like to set out some basic principles for everyone to keep in mind. First, it's critically important to center community members in decision-making and give them the power to shape policies that will directly affect their lives. Conservation is not a novel or modern concept. Native communities have been engaging in environmental protection efforts for centuries. And without building these concepts into our work, we risk a greenwashing effect, wherein companies, politicians, or communities take action in order to appear to be helping marginalized communities without actually addressing the underlying issues that put them at risk, like racism, poverty, and settler colonialism. We should work to identify and improve outcomes, not just improve processes, like translating meetings into different languages. And we should hold our leaders and lawmakers accountable when we hear ambitious plans but fail to see meaningful action. Next slide. Okay, now that we've established some of those basic principles, let's chat about individual actions to address climate change. Next slide. There are several actions that we as individuals can take to reduce our carbon footprint. Using helpful tools like Project Drawdown, which you can find online, we can all take stock of just how much we are contributing to the greenhouse gas emissions that cause climate change. 3 of the most effective changes that are highlighted here in orange that we can make on an individual level are, number 1, walking, cycling, or taking public transportation as opposed to driving in personal vehicles. Number 2, we can eat a heavily plant-based diet with less of the meat and dairy that are so costly for the environment. And 3, we can reduce the amount of food we waste each week, which is often the result of overbuying on groceries and takeout. I know we're all guilty of that. Next slide. Another key step we can take is to participate in local restoration projects, like this group from Seattle Children's did last year as part of the Green Team. These efforts not only remove invasive species, thereby restoring biodiversity in our green spaces, but they're also shown to reduce climate anxiety and combat feelings of hopelessness for young people who are disproportionately affected by the climate crisis. Next slide. We can also leverage our personal influence to take action through our organizations, including as pediatric healthcare providers. Next slide. For example, Andrew Lewandowski is a pediatrician in rural Wisconsin who routinely includes climate change in his anticipatory guidance for families bringing kids of all ages in for their well checks. His spiel is included here in this slide, and we don't expect anyone to copy this word for word, but we do think it's a great starting point for others to reference in creating their own messaging about climate change that they can use in clinics or other care settings. I'll give you a second to read it. Next slide. Taking this concept beyond the exam room, we can lead initiatives to produce patient-facing education materials, like this impressive booklet that's being used at some King County public health clinics around the Seattle area. We can also petition our organizations to compost, support local farms through their food purchases, and use native plants in any landscaping or beautification projects. Importantly, we can also use our collective voices to advocate for divestment from any stocks, bonds, or other funds that are unethical or invest in fossil fuels. Next slide. At our institution, we're taking steps to create a climate change and health curriculum that can be distributed to other pediatric residency programs so that future generations of pediatricians will feel better equipped to manage their patients' climate-related health issues. On this slide, you can see a few of the topics we're covering in the form of noon conference lectures this year. There are also several examples of curricula that are available to share within your organizations, such as Emory's Climate Seminar Series and Yale's Climate Connections podcast series. Next slide. Next up, community activism. Next slide. 5 or 6 years ago, industry and city leaders proposed a new Kalama, Washington methanol refinery. The plan was to take fracked gas from Canada and pipe it down to Kalama, where it would be refined and then sent to China to make plastics or fuel. People from all over the state and the country submitted thousands of written comments and public testimony urging the Washington Department of Ecology to reject the project. You can see some of them demonstrating. Next slide. In their final decision letter, the Department of Ecology announced that its environmental analysis found that the facility would emit nearly 1 million metric tons of carbon dioxide a year, and that project proponents failed to show that the public interest could be protected from the detrimental effects of the plant. They could not, in good conscience, approve the proposal. We choose to highlight this story as a counter to the prevailing narrative that climate change is overwhelming, irreversible, and inevitable. As with most things, the reality is not so black and white, and there are many forces of good at work in this fight. Next slide. There are several environmental justice community organizations across Washington working at the community level. Just a few examples include Front and Centered, a coalition of communities of color-led groups across Washington state, whose missions and work come together at the intersection of equity, environmental, and climate justice. The coalition actively works toward a just transition from an extractive economy toward a regenerative economy. Next, the Duwamish River Community Coalition represents an alliance of community, tribal, environmental, and small business groups affected by the ongoing pollution and cleanup plans for Seattle's lower Duwamish River. The coalition works to elevate the voices of those impacted by the Duwamish River pollution and other environmental justices for a clean, healthy, equitable environment for people and wildlife in the area. And finally, the mission of the Northwest Climate Resilience Collaborative is to assist tribes and frontline communities in improving their resilience to climate change while addressing the legacy of systemic inequity that continues to influence their lives and livelihoods. This effort brings together 10 organizations and universities across the Northwest, including academic researchers and community-facing organizations and nonprofits. Frontline communities are centered in this effort. They're represented on the leadership team and in leadership roles across the collaborative. They also help shape and implement the collaborative's research agenda and connect that work with community-based resilience efforts across the nation. Next slide. Finally, legislative advocacy. Next slide. Recent legislative sessions have seen a lot of progress toward climate-related goals. For example, in 2021, the Climate Commitment Act was passed, and this eventually took effect in 2023. The Climate Commitment Act caps and reduces greenhouse gas emissions from Washington's largest emitting sources and industries. It also includes measures to improve air quality in Washington communities that are historically overburdened with health, social, and environmental inequities. Finally, it aims to reduce air pollution made up of ozone and fine particles in areas of the state with the worst air quality. Also, Move Ahead Washington, which is a cleaner transit package, includes $3 billion for mass transit projects across the state, including tribal transit grants, as well as funds to help seniors, children, and people with disabilities reach their destinations. Next slide. In summer of 2023, Washington State launched updated heat protections for outdoor workers. Under this new policy, employers must follow high heat procedures that require close observation of workers and mandatory cool-down periods that get longer as temperatures rise. There are enhanced rules about when and how employers should allow workers to drink water and access shade. And this is another success brought about by collective demonstrating and organizing. Next slide. The upcoming legislative session, as many of you probably know, is a supplemental budgeting session. So fewer big packages are up for debate, but there are some issues to watch for and support in the upcoming legislative sessions. First, we at Peds for Climate Action support an expansion of passenger rail infrastructure to reduce carbon emissions along major highways. There are two projects that are currently under discussion. You may have heard about them. One is a brand new high-speed rail project versus updates to existing rail routes, including the Amtrak Cascades routes and a neglected corridor between Seattle, Yakima, and then eventually to Spokane. Based on the high cost of the high-speed rail, it's $150 billion versus $15 billion for the updates, and the land requirements, 3,000 new acres for the high-speed rail versus 300 new acres for the updates. The Washington Physicians for Social Responsibility has recently taken the stance to prioritize Amtrak Cascades and oppose the Cascadia high-speed rail for now. Second, we also support House Bill 1181, which proposes significant changes to the Growth Management Act that will support community resilience and climate adaptation. And finally, along with many groups, we are advocating for improved building standards across Washington, replacing gas furnaces with electric heat pumps and installing electric instead of gas stoves will reduce toxic exposures for children in their homes and bring down the amount of harmful emissions that come from our homes and offices. And just to share about another recent win, just last Friday, the 1st, the Seattle Building Code Council passed updated building codes. These codes will require new homes and buildings to achieve the same total energy performance as buildings built with electric heat pumps, while allowing builders the flexibility to choose appliances. Electric heat pumps, which provide both heating and cooling in the same unit, run up to 3 times more efficiently than gas furnaces, and builders are widely expected to choose them in new constructions, as they already frequently do. Next slide. We wanted to end this section by highlighting youth advocates who are in many ways leading the fight against climate change. This is a photo of demonstrators with the Sunrise Movement, a youth-led organization active across the nation. Sunrise is pushing for a Green New Deal through grassroots organizing. They know their current leaders aren't doing enough to protect their futures, and they've turned their fears into action through organizing. Next slide. We hope that reviewing these actions has inspired you to pick 1 or 2 things that you can do to reduce your carbon footprint and support efforts to combat environmental racism. We'd love to hear in the chat maybe about some of the ways that you're already engaging in this work in your communities. And we thank you so much for inviting us to chat with you today. We can't wait to keep working with you to help protect our children and our planet. Thanks.
Well, that was an extremely efficient presentation. So thank you guys so much for that. And it means we have time to chat. And so we will unshare screen And there are a couple of questions that have already come through, so I wanted to give you guys a chance to address them first. Let's see. So one of them was related to the anticipatory guidance section, and where to find that information and if it is available in languages other than English.
Yeah, so Andrew Lewin, I think probably the best way to do it is just to Google Andrew Lewandowski, and he wrote a paper back in 2021 that spells all this out. And then he also goes, he polled the families that he did this anticipatory guidance with, and in like rural Wisconsin, which is not the most liberal place, still most of the people either found it helpful or were felt neutral about it. And so he like delves into some of the data there about incorporating this anticipatory guidance. Unfortunately, I think it's only in English, but that would be I think that would be an excellent effort to try to put it into different languages as well.
And the King County reference, the climate changes health, that booklet, do you know if it's in other languages as well?
So I've only seen the English one over at Eastgate. I think I saw Crystal on this call as well. I'm not sure if it's in other languages. I think there's this one is on King County Public Health's website as well, but I would have to look into that.
Okay. And then is there a bill this upcoming 2024 legislative session for improving building standards?
I am not aware of one, or at least it hasn't been discussed in many of the circles that I've been a part of. I think that the building standards has been handled more on a local level than necessarily statewide, but that doesn't mean that there hasn't been. And I think, people across the state, the building, builders organizations have been very anti, strict rules around making that switch. So it hasn't always been very successful, but I think on local pockets are being more successful with updating building standards. And so, Sarah, if you know of the past one, I'll be happy to look into it and see if there's anything that's been new for upcoming session.
Any other questions? I think I covered all the ones in the chat. I tried to get it to everyone. All right, from Dr. I think so how do you see a role for education regarding environmental justice in pediatric residencies across the country?
I think we need more of it. I think it feels like in the last couple of years, like I was mentioning before, there's been kind of a real shift where a lot of us doing advocacy in this work up until recently have been kind of focused on like convincing people that like climate change is real, it's a problem, and it's affecting our health. And I think really in the last couple of years, there's been a real surge in like I was mentioning, like education and papers. And I think now we're getting to the point, which is really exciting, where everyone where most people have kind of like a baseline understanding of like, okay, yeah, like this is a problem and like this is affecting our health and is going to affect our health moving forward. And then I think now as a community, we really need to start, in my opinion, start focusing kind of on the next step, which is, okay, now that we've like convinced people this is a problem, let's now turn a more like justice oriented and environmental justice oriented lens on, and now talk about, okay, how do we like get everyone else up, get everyone an equal seat at the table and get everyone equal protections, like we were discussing. And I think at this point, our organization, like Mary Beth was mentioning, has put out a couple of or invited a couple of really great speakers to talk about kind of climate change and health in general. And I think other residencies should work on adopting that as well. But then I think importantly, either all of those talks should have either an element of, how does this differentially affect people in our communities? And then also maybe talk more about or highlight like environmental justice in particular. That was kind of rambling, but basically, yes, everyone should be educated on this.
Some other really great questions coming through. Dr. Molly Groh did put in a great resource for current MOC Part 4 offered for primary care counseling. So hopefully people check that out. Another question came through. Do any of the speakers have data or information about how these environmental factors are responsible for the health disparities that have until recently been chalked up to racial differences, i.e. earlier puberty in Black girls and differences in GFR is not due to genetic/racial differences, but rather environmental factors? Do we know what these are, so we can target them directly? And I can post that question if you need me to redo it.
I would say that like those two health problems specifically, early puberty and GFR, I haven't come across anything like specific to that in my work yet, but one of the most profound like disparities is pediatric asthma, and that has absolutely been shown to be much more related to your environment, the quality of air in your home and the quality of air around your home and your exposures. And so that certainly is an area where we can say there is scientific evidence that it is not at all related to any underlying difference among children. It is due to their exposure. So as we continue to see more research on this topic, I think it would be a great idea to pick one of those in particular to see if we can dismantle those myths with actual data. And those are happening more and more because more people are aware of how environmental factors and climate change are impacting kids in different ways. So great idea to look for that.
Yeah.
There was sorry.
No, please.
There was a paper that was recently published in, I think, the Journal of Allergy and Immunology that I can post that did a really excellent review looking at like atopy in Black kids in general. And so looking at asthma, but in particular like eczema, which is seen in higher rates in Black children. And basically they did a review of folks had done like genetic analyses, some other like biologic analyses, and none of those could be tied to the higher incidences of eczema. But what was tied to higher incidence of eczema was like higher exposure to the things that we mentioned earlier. So like proximity to highways, proximity to increased air pollution, and then just kind of like other forms of stress in particular. So but we can post that as well. But yeah, similar to Mary Beth, I have not heard anything in particular about GFR or precocious puberty.
Yeah. And feel free to send also, you can send me any links as well. We can make sure we get it out to all the people that attended this morning also. And actually there's some really great research out of the University of Pittsburgh as well, because Pittsburgh is a steel mill town. And that a lot of those mills are next to neighborhoods that are predominantly Black, brown, and under-resourced. And so looking at asthma rates, it is noted that they have incidences that are 3 times greater than the general population, which is also very fascinating as well. So you can check that out. I think that work was done by pulmonologist Dr. Sean Angela. I said that correctly. So yeah, thank you for passing on that information. So just a comment from personal experience, I know it is not easy to find out about the rules, regulations, permits to transition your home from gas to electric heating or cooking. It costs quite a bit, and there needs to be more funding for lower income and BIPOC homeowners to make these changes, and especially outreach to limited English proficiency communities. Also, renters need more power to get their landlords to make these changes. And so I just want to highlight that if you guys have any comments about that.
Just to say, absolutely. There have been a lot of pushes around the state to increase the amount of funding to help people make these transitions and have rebate programs. And we need more of those sorts of efforts. I think there was a good amount of funding in the Biden infrastructure deal that passed. But it's not enough to trickle down to all the communities that need it. And this kind of work is just really nitty gritty, working with builders and people who are really experts in the field of electric appliances versus gas, and it requires a lot of careful attention. And so I have done a little bit on this issue, but even I still have so much to learn. And so I feel like it's a big lift to get that money and that support to the communities that need it. But those are absolutely the people who need it the most, not the people who can actually afford to go out and buy their electric stove and then apply for a rebate that only covers half. So yep, we're in this together to help make that happen.
And then I think there was a question about templates for letters to get landlords to improve their buildings. And that information for kids with asthma, that information is through the Washington Medical Legal Partnership, which has letter templates. They do a really, really great job with that. So yeah, I tried to get through all the questions. I think I got them in fast, furious fashion. And so any other questions, people are welcome to unmute if they have any.
Peter, could you just put up the slides one more time that have the contact information? Because I think we'd love to keep people who are interested in this topic engaged in our advocacy collectively through our chapter as well as nationally. There's some wonderful work happening now as the momentum is building, and thanks to Mary Beth and Simona for highlighting incredible talk today, highlighting so many great opportunities for us as pediatricians. And we'd love to have anyone who is interested in the advocacy piece for our state be involved. I know Allie Perkins, who's at COP, I just posted an answer to Nancy saying that is at the COP meeting, and she's really galvanized our group through the residency and through UW, and we'd love to have people who are interested join us in continuing to advocate and hopefully continuing to have a little bit of a committee or group through our chapter that can be addressing these issues together and in collaboration, as Sarah Rafton said.
Absolutely. Yes, and so that is the contact information, and I love that this work has really become front and center, especially in the last 2 years. And I always say that when the Equitable Care Committee picks webinars, we never know what's coming up in the upcoming year, and somehow we tend to really sort of stick the landing in that regard. And so this presentation comes at a really, really good time, especially given the last year that we have had and how it's greatly affected children and their caregivers. So thank you guys so much for taking the time to give this talk, because it's very timely and it was spectacular. So anybody that is willing to join the efforts, please reach out to the group in the slide. And I'm going to ask Alexis to do a couple things while we wrap up here. So if we could post a link to the toolkit, just so that everybody has access to the current toolkit. And like Dr. Kathleen Kieran said, we will be doing a revision in the next couple of months. And so you can sort of download this version now, but just know that the next one is coming up soon. Alexis also posted a link about registering for our advocacy day, which is on Monday, February 12th. And so some of the bills that were highlighted in this session, of course, are bills that certainly, if you are talking with your representatives, you are welcome to discuss as well. The other thing, so I'm trying to get through everything. Our next webinar will be at the end of March, and so that information will be coming out as well. So please be on the lookout for that. And then certainly we are always asking for feedback on our webinars. And so that link was also posted in the chat as well. Yes, thank you for reminding me, Dr. Gass, if I said that name correctly. This recording will be posted on our website in the next week or two. So just give us some time to do that. And anybody can sort of take a look at this presentation at that time. And then certainly if there's any links or attachments that is sent by Dr. Martin or Dr. Bennett, we will make sure we get that out to all the attendees at the time that we post the webinar to the website. Okay, I think I got everything. Did I miss anything, Dr. Kieran?
Nope, I think you got it all.
All right, perfect. Well, we always love to give people time back on a very busy week. We hope that people have a wonderful holiday, whatever that means to you and your families. And thank you so much for attending today. Happy December, and see you in 2024.